think it's okay if I stand here, right? A bit height challenge. Well, thank you for coming today, and hello to people on Zoom as well, and thank you, Sue, for going first. So today I'm talking about creativity in mental health and sharing a little bit of a reflection from my own experiences, having a long-standing interest in the potential of creative practices in mental health, but really only much more recently having a go myself at incorporating some creative practices into my own work. So here's an artwork by Miranda Epstein, which I came across more than 10 years ago now. And Miranda has an amazing body of work which you can access online. And I think what she is able to capture in her work, visually and using creative writing, is incredibly compelling and valuable. Let me just give you a moment. So stepping back a little bit, I think many of us probably in the room here today would agree with the statement that there is a mental health crisis of some form. We probably wouldn't agree on what that crisis is exactly. Is it something in the community about rising levels of distress, perhaps? Is it something within services, service provision? But, you know, we hear comments all the time, you know, the system is broken, people's needs are not being met, and there's some form of unfolding crisis. In response, I think there's kind of two polarised positions that can form in response to this perceived crisis. On the one hand, technical fixes. So things like new practice guidelines, new staff training, some form of new therapeutic technique that is going to, you know, holds a lot of promise and is going to fix things. On the other hand is another position, which is a really strong structural analysis of the mental health system, its inherent flaws, power imbalances, and this can be quite compelling, but also it might be that we quite quickly feel rather stuck and hopeless. So where do we actually go now that we've, you know, analysed and named the sorts of things that are going on that are really big? So what this binary thinking can lead to is, on the one hand, somewhat tokenistic kinds of reforms, co-design that many people who've sort of tried, you know, to bring their lived experience into the mental health space have referred to as faux design. So in other words, you know, yes, bring in your lived experience, but only certain parts. And, you know, we're in a big rush because of this crisis that we've got to fix today. So we don't really have time to kind of listen to the complexities and nuances. On the other hand, the other kind of side of the binary is this strong structural analysis, which also has its limitations. So as Latour notes, you know, our critique can run out of steam. Where do we actually go now that we've kind of established this really big structural analysis? It can seem like there's really nowhere to go. So while on, you know, these two ends of the binary are quite different to each other, what's interesting also is that they have some things in common in terms of their approach to knowledge production. So for example, there's a strong focus on, you know, text-based responses. So document production is the kind of primary response to what's going on. Also a really strong focus on, you know, a cognitive approach, so intellectualizing the problem. Also, a really strong focus on certainty and valuing certainty. And in addition, often the marginalisation of lived experience expertise. So in the time that I have left, I want to talk about a research project that I've been involved in recently, acknowledging the whole team, including researchers with lived experience, and working with women who have experiences within the involuntary mental health system. So doing research in a way that is incorporating creativity and arts-based approaches. So here you can see an artwork that came about through a partnership with a professional artist who worked in a participatory way with women in the project to represent some of the project's findings about mental health assessment processes. And so here specifically, this is about what it's like to be on the receiving end of a mental health assessment process. We've also facilitated lots of workshops with women, meeting together and inviting women to start to create their own art as well. And so through incorporating creativity into our research, we've found lots of potential benefits. We've found that there's space opened up for complexity and multiplicity. So it's not about finding a single truth or kind of developing some kind of rigid framework, but actually leaving space for multiple perspectives and understandings. We've found that there's space for listening to emergent knowledge from the margins, so experiential expertise that has been discounted even within a lot of the kind of co-produced kind of research projects that have been done. There's space for what we don't yet know or sitting with uncertainty, and space also for collective kinds of knowledge building. So this piece is about processes. It's about what happens when women are invited to come together, where there's space to talk about experiences in, hopefully uncensored ways, and to talk about potential collective social actions together. So creating space through, using creativity in the process, sensory and embodied knowledges that, may not always be present within research projects. We held an exhibition a few months ago, which included artworks on the wall as well as some installations. This is one of the installations. It is about items of comfort, items that are often not available to people during mental health treatment. The idea was to ask people who came to the exhibition, what do you want or need during times of crisis, distress and suffering? Why is it that we offer something so different to people who've been labelled with a psychiatric diagnosis? And so here we noticed that a creative approach could invite dialogue potentially across people with diverse experiences, perhaps inviting an analysis of the mental health system that moves beyond a cognitive approach. And actually, without asking, people added to this table during the exhibition, which was really fantastic. It's an invitation to a conversation, or at least that's the intention, rather than telling people off for not getting things right or not agreeing with us or not having the right perspective. And this is another installation that was part of the exhibition. It's called Feedback Box. It's a collective artwork by 3 women in the project, pieces of feedback to a service that's scrunched up, and inside this box, which is decorated with all the barriers to providing feedback that, can occur within mental health systems. So, a powerful analysis, reclaiming power, but also humour and subversion too. This is my last slide. So while there is a sense of urgency, in mental health context, and it's quite understandable, this can lead to, a very strong focus on service provision, more services, and somewhat tokenistic reforms. We've found that there's value potentially in slowing down a little bit, and arts-based research, is about slowing down. It's not a fast process. But there's time and space to engage perhaps a little bit more deeply and broadly. This photo is one of the artworks that was part of the exhibition. The words that were with it was, I need help, just not this kind of help. So let's not keep just doing the same things. At the same time, we found that through engaging with lived experience knowledges, perhaps we're not just in this really stuck position. Perhaps we can actually start to see what some of the possibilities are. And finally, creative practices, of course, can be co-opted by the neoliberal and biomedical perspectives, but I don't have time to talk about that, so that's for a future conversation. Thank you.
Fantastic. Thank you so much, Emma. Stay there. And we're going to ask for questions from the floor or via Zoom. Any questions for Emma? Yes. I'll grab it.
I'm not a social worker, and so I speak very much out of ignorance, but I just know that you've done, I was really interested in Sue's talking about co-authoring, and I know that you are critical of overly text-based responses, but I just wondered if you could expand a little bit on your kind of co-production and co-authoring that was, I presume, not faux authoring. Okay. Yeah, thanks.
Yeah, so I think in the sort of mental health research space, there's a really strong discourse around co-design, and a lot of how that's operationalized is, quite mechanistic. We'll run a meeting and that's how we'll do the co-design. And what we've found in this project is that, we've had the resources to work with people over a significant period of time. And, it's in walking to get a coffee that somebody will offer something, and so it's actually about being open to, okay, that's knowledge for our next steps. And really kind of, it's a form of listening, I think, and taking time that has been, really generative in this project.
Thank you, Emma. Any other questions or comments? Thank you.
Hi, Emma. Thank you for the presentation, and good to hear that you're starting to look into arts-based research, which is really, emerging and increasing in social work as of recent. But there's very little discussion around both representation and dissemination of art-based research within the scholarship. So what are some of your considerations around both representation of course, your co-producers of knowledge, and also dissemination of the research more broadly?
Yeah, thanks.
And also some of the objections you will, of course, get to whether does this count as valid knowledge because it's produced through these alternative methods.
Gosh, okay, that's a lot. That's a lot to respond to, but thank you. I think, we had lots of conversations before the exhibition about what each woman hoped to achieve, and there were diverse perspectives. Some women were really clear that they wanted to represent their identity outside of the psychiatric system and, their resistance. Other people really wanted it to be a truth-telling exercise and, to really say, this is what happens in the system. People in the general public are not aware, and I want it to be about a human rights conversation. So, we really kind of spoke about that and tried as hard as we could to make space for multiplicity and to, put as much of these diverse perspectives into the exhibition. So that's a representation point. You also asked about dissemination. So I guess we held it in a place that was, accessible by the general community, lots of, people walking past. And so we had, fairly diverse people come in, people with lived experience who really, it resonated for them. People from health services, we had students come as well. And your last question was?
About how you have already or imagine that you will react to or respond to some of the pushback on this being or constituting valid knowledge that can be used in further research or even practice development.
Yeah, I think certainly that's a question. I would flip it and say that hopefully this form of knowledge production is less easily co-opted. Can't put this into a practice guideline and sort of tick it off. And so, yeah, that would be my response to that. Thank you.
Fantastic. Thank you so much, Dr. Emma Tseris.